from your mama's porch. Be your own tempo keeper. That's who I be. That's my life purpose. That's what I do because I love balls. Everyone knows men produce more testosterone, and when you think the female counterpart, estrogen. Oh, and also a man has a prostate. Men can suffer from low testosterone levels. It's called a testosterone deficiency or hypogonadism. Gonad, the man's gonads. Hypo meaning low. That's the hormone that, that gives that sexual energy, that passion, taking action, assertiveness, aggression, competition, war, stuff like that. It makes the man physically stronger than the woman. And there's two different types of hypogonadism. There's primary and then there's secondary. Primary is when your testicular region, you have a testicular issue where it's not producing testosterone like it should. And the secondary hypogonadism is where your pituitary gland, which is right up under the brain, like in there somewhere, or you can just go through your forehead, third eye, is misfiring. So your pituitary gland and testicles, they work together to produce testosterone. With primary, the testicles are malfunctioning. In secondary, the pituitary gland is not giving the right signals to release testosterone. One can happen by itself, and then both of them can happen at the same time. So yeah. Symptoms of low testosterone. You got low libido. You just I don't have the urge. ED over time. ED stands for erectile dysfunction or low sperm count. Prostate is in charge of producing sperm, semen. The prostate and testosterone production can be affected, and we'll get into that in a little bit. Low energy. You don't feel like getting up to do nothing. You just have just a poor sense of self. I don't want to do nothing. I have no joy in the stuff that I used to enjoy. I'm just not feeling it, bro. And with low energy, it goes hand in hand with depression, hopeless, and just thinking to yourself like, man, what is life? What is life? I don't like it. You notice how depression is very common, and depression can be caused by a multitude of things. If you know the cause of your depression, you can go to your therapist, you can go to your counselor, your psychologist, or a traumatic experience that you experienced that is causing your depression, or just stuff that's just been piling on over time that's caused your clinical depression, and you can see your psychologist or therapist or counselor. Sometimes depression can be caused by physical issues, low hormone levels, things like that. It could be medications that can cause it. That's why I recommend going to see your primary care provider first, because it might be time for you to get lab work done anyway. And typically your primary care doctor will get labs drawn on you, and they will test your testosterone along with it in your blood work. And you have to be in there fasting, probably in the office by 9 a.m. fasting for about 8 hours. So after midnight, no food, No drink other than water. Nothing in your mouth other than water and your medications. It's no fun, but it gives you an accurate reading of your labs. That way you don't have to get poked again. Once they see that your testosterone levels are low, then they can treat you. They can start the process of getting you treated for low testosterone. But if there's nothing wrong with their testosterone, it could be something else. It could be you might be low in a vitamin, malnutrition, things like that, lack of exercise. So it can be a multitude of things. So like I say, see your primary care provider first. And if he weighs out all his options, then he'll send a referral for you to see a specialist. Get deep in there and figure out what's going on. With low testosterone, you'll notice a decreased hair growth on your face and on your body and places. Men that got hair everywhere and might not be on their head. Some do, some don't, but typically you'll see the beard and the mustache and they're like, okay, nothing's growing on my face and I'm concerned. Decreased muscle mass, because testosterone is in charge of also building that muscle. When you're exercising, the hormones work with your proteins in your muscles to build muscle and to repair muscle, during workout recovery, after workouts. When you're feeling sore, that's all that working together to get you toned up, get you buff and stuff. Gynecomastia, an abnormal growth in your upper area in your chest. Also abnormal genitalia. Abnormal genitalia, where it looks like is that supposed to look like that? What does it grow? It just looks like a whole belly button, like a little outie belly. Don't mind me. It's a symptom of low testosterone, and it could be genetic. Of course, it's genetic because it's not going to shrink. Moving on, osteoporosis, where calcium isn't building up in your bones. It's causing little pores in your bone. It makes your bones brittle, making you susceptible to fractures more easily. Treatment, hormone replacement therapy. You can get patches if you're trying to get testosterone back. There's patches you can take. There's a gel that you can put on your shoulder. There's also, there's a surgical procedure where they take Testapel, which are like implantable pellets. And it's like an outpatient procedure where you just go to the doctor's office, and if the doctor performs this, they'll make a small incision and put those pellets inside, like in your bum. You wouldn't have to worry about injections, which injections are the cheapest option, because implantable pellets or Testapel and patches and super expensive. The gel by itself, Androgel, that's a brand name for one of the gels, that can be like $1,000 for a month's supply, depending on your insurance and what the insurance pays for. Injection would be cheaper. You'd be getting vials, depending on however much testosterone he wants you to get administered to you. If you were to come into the doctor's office, that way, let's say I'm the medical assistant, I used to give these all the time. You would come in once a week. He'd probably tell you to come in once a week or once every other week to get this injection. And then you get your blood drawn after 8 or so weeks to see where your testosterone levels are. And then get your appointment, see if you need to decrease or increase your testosterone, and keep going until it's at a normal level for an extended period of time before stopping. And then there's some people that learn how to self-administer the testosterone. Some men, bring their wives in, and then I would demonstrate to the wife how to administer it. That way she doesn't injure him. That way you can properly safely administered. And it's a thick liquid too. So you get like thick needles, that way the stuff can come out easier, and it's yeah, but it works and it's cheaper. Prostate disorders. Small gland in men that helps create semen. It's located in front of the rectum and it's like below the bladder, and it's wrapped around the urethra, which is that opening that comes out where semen and urine comes out. One common disorder that men have complaints of having is BPH, which is also called benign prostatic hyperplasia. That's when your prostate is enlarged. It can be enlarged due to numerous things. Signs or symptoms: you would have increased frequency. You would go probably every 10 minutes, 15 minutes. You'd probably think you're pregnant. Men. Just an increase in urination. You would go probably every 10 minutes, you just have that urgency and an increase in frequency in urination. And you would have the urgency to go to the restroom more often at night. It's another sign. You would wake up in the middle of the night and you're like, okay, I gotta go pee. Go pee and go to bed. Wake up again in like an hour and then go pee again. Go back to bed. And it gets annoying. Also, hesitancy, where you're trying to go to the restroom, you can't go. It's not coming out. It just will not come out for anybody. It just will not come out, period. And it's frustrating. And I gotta go and I can't pee. It won't come out. I don't like this. That means the prostate is so enlarged that it's putting pressure against like your bladder to where the urine is not coming out. And it's very uncomfortable and frustrating, and it'll make you want to call that doctor ASAP and get in. Like, hey, what's going on? Help. A weak stream, like I say, the prostate would be enlarged so much that it would put pressure to where you're not able to go at all, or it's coming out in like dribbling weak stream or whatever, and it's coming out real slow. Or an inability to complete urination. That's another sign. Probably feel it in like your lower back. Remember, like I say, you probably feel something in your lower back and you don't know where it's coming from, and you've been going to the bathroom weird, and it's like, okay, this ain't normal. What is going on? Pain in your lower back, your groin area, that whole pelvic region, tip of the penis, and it's like, okay, SOS, doc, what is this? That's when those stubborn men are like, okay, I'm not going to the doctor. Ain't nothing wrong with me. 10 minutes later, they got to go to the bathroom. Then another 10 minutes, they got to go to the bathroom. All right, where's this doctor at? Come on, so you can give me this medication so I can go back to work. And then get mad when he gets a referral to a urologist. You should have went when we told you need to go get your yearly exams. You ain't got to worry about this. Alrighty. More serious note. This is a very common form of cancer. Prostate cancer is the most common in Black men. The most common in Black men. But is most common in Black, Latino, and Indigenous Native American men. The lowest rates of having that type of cancer in Asian men, with surveillance to monitor growth and possibly a surgical excision if it's like really like it's localized to that one spot in your prostate. So they go ahead and just take the whole prostate out with the surgical excision. And that's called a prostatectomy. Possibly pellets too, to stop the production of testosterone, or X-ray radiation pellets, or radiation through X-ray rays, hormone therapy to stop testosterone production if it's likely for reoccurrence. Also, if it's metastasized. So the testosterone reduction therapy would be for if it's metastasized, if it's spread around other parts of your body other than the prostate, or if it's localized in the prostate, then they'll just go ahead and just do surgery to remove the whole thing. It's important to get prostate checks before, if possible. They would do prostate checks before 50 if you're having symptoms. Otherwise, they wouldn't do it if it's not medically necessary. But if you're having symptoms like increased urination, blood in your urine, things like that, something ain't normal, something ain't right down there. So they're like, okay, so y'all know what happens during prostate checks, right? Rectal exam. Now, I know y'all don't like the idea of prostate exams. It's just one and done. Check, done. Us women got to go through stuff like that too. We got to get a whole smear. Like, okay, why are you taking so long down there? First of all, Jesus ain't down there. Are you done? Are you done? Are you done? And it's weird and like, like, okay, come on with it, hurry up. But men, that's what men got to do to prevent cancer. The earlier the detection, the more of a chance of full recovery, and less of a chance of, finding it at a stage where it's not treatable. But yeah, prostate checks before 50 years of age or at 50 years of age. That way your insurance will cover it. They would check through a lab draw your prostate levels, which is called your PSA. If it's elevated to a certain level, then they would do like a rectal exam. It's all depending on what the doctor feels like he needs to check and see what course he needs to follow to, go about treatment, give you medication. If it's like, if it's like an infection, then he'll give you like a course of medication for a week or 2 weeks and then call you, see, and then come back and then check and see if it's gotten better. Or if it's so high to where they suspect malignant cells, then that would be a whole different ballgame. They'd go and they would get a biopsy from your prostate, check to see if it's any cancerous cells, and they go from there. Symptoms of cancer, you would feel burning or discomfort when going to the restroom, like on fire. Hesitancy where you're not able to go. You have a shy bladder, is what doctors tend to call it. They have a shy bladder to where they just cannot go. It just will not allow them to go. Urgency to where they have the urge to go. I gotta go right now. Incontinence to where they can't hold it. They gotta go and it's coming and you trying to stop it, but you can't stop it. It's coming right now. Low stream, where it's just trickling out slowly. Blood in your urine or blood in your semen. Erectile dysfunction. It's another sign. Those are signs. Now, that does not necessarily mean that you have cancer. Remember, I don't diagnose, I don't assess, I don't treat, I don't cure. I'm not a doctor. All of this is informational purposes only. Do with this what you will. This can be found on the internet. Dr. Google. Dr. Google. Now, this is another thing that I wanted to give to y'all. I recommend, this is a bonus fact, so do your research on the internet. This is like free information on the internet that you can find regarding this study. And, you know, consult with your doctor before just going and, you know, just having a blast doing this. But there was a Harvard study that was conducted that showed frequent orgasms by the man, they say 21 times monthly. 21 times monthly. Once a day. All month except 7 days. You know, orgasm through sex or through masturbation. If you do that consistently, then it will decrease your risk of developing prostate cancer. It was on the internet. They said Harvard did it. So I said, okay, I thought I would give y'all that information to go ahead and research yourself. So, and that brings up a point because, like, you know, men are sexual beings, and if they can have it every day, they'll get it every day. Now, you know, men are visual creatures, men are sexual creatures, and, you know, it's not even like a desire. Men not only desire a lot of sex, but it saves their life. You heard it from me. Sex saves men's lives. It's a survival. It's survival. Now, this study showed that there was a decrease in risk of prostate cancer when they did it like for younger adults, and then for like older adults, so like middle age, like 40-ish, I would think. Like I say, do your research, ask your doctor, because your doctor knows your body and you know your body. Consult with him and see what he thinks about it. Show him whatever article that you saw talking about Harvard in their study. But if it checks out with him, then, you know, knock yourself out. Don't knock yourself out. Like, you know, don't poke your eye out. That's so bad. All right. Whew. Now, prevention. Let's talk about prevention. Important men's health tips. Number 1, go to sleep. Get 7 to 9 hours of sleep every night, or just rest overall. You should be getting a good night's sleep every night. Like, make that a religion. Like, don't sleep is a healer. Water is a healer. 7 to 9 hours nightly. Reduce your alcohol intake. For men, it's recommended that you consume less than 2 drinks daily. So if you like binge drink, if you drink like a whole 6-pack every day, gotta cut it down. Diet. Reduce your sugar intake. Reduce your carb intake. Simple sugars, like anything white bread, white sugar, syrup, corn syrup, Like honey is okay, but in moderation. You know, just simple carbs, simple sugars, like white, you know, processed stuff. No, unhealthy fats like shortening, Crisco, vegetable oil, anything that hardens in room temperature, anything that says trans fat, hydrogenated fat, where it was liquid in its natural state, but you know, oxygen or whatever was put into, hydrogen and oxygen molecules was, you know, processed into the fat to make it solid. It's no good for you. Fast food restaurants use it all the time as a preserved fat to cook their foods. It's not healthy at all. Stay away from that. Stay away from unhealthy fats, carbs, sugar, salt. Stay away from it. Stay away from way too much salt. Drink water. Water. 64 ounces or more every day, or at least half your body weight in ounces or more per day. Water. What I tell y'all, every video I will mention that good old H2O, water boy. Increase your fruits, vegetables, whole grains intake, and then specifically foods that support healthy prostate health and boost testosterone levels if you suffer from hypogonadism or low testosterone levels. You can take omega-3 as a supplement over the counter. You can get that over the counter. You can get a prescription from your doctor to get omega-3. Eat more broccoli, eat more green vegetables, eat more green leafy vegetables, deep green leafy vegetables, kale, Swiss chard, arugula, romaine lettuce. Iceberg lettuce is nothing but crunchy water. That's all it is. Cayenne pepper helps with prostate health, so you know, spice it up a little bit. Green tea and coffee helps to build up your prostate. The tomatoes have a certain nutrient in it that's really good for prostate health. Beans, pomegranate juice, any fish, berries, avocados is good for prostate. For a boost in testosterone, you can eat fortified cereals, basically any foods that have a good zinc and or vitamin D content. So vitamin D, zinc for testosterone. Fortified cereals. Oysters have a lot of zinc in it. Shellfish, Alaskan crab, they say that has a lot of zinc in that. Beef, they say liver. Beef liver, ground beef, and chuck roast have a lot of zinc and vitamin D content. Also beans like chickpeas, lentils, baked beans. Did I miss one? Vitamin D milk, egg yolks. Now I want to tell y'all about egg yolks because egg yolks are good, you know, when it comes to getting those vitamins from it, but be careful not to eat too much eggs because eggs have a really bad reputation of bringing up your cholesterol level. So it's like it defeats the whole purpose because you're eating eggs for one thing, but you eat too much of it and then you got a whole nother issue. So you know, just be mindful and be careful. because the egg yolk by itself, that's where all the cholesterol is. So, you know, again, tuna, salmon, that has omega-3, 2, and zinc and all that good stuff in it. So those are food choices that you can do. Stop smoking. Stop smoking. You heard me? Stop smoking cigarettes. Stop smoking cigarettes. Like, come on. I mean, I don't understand the, you know, the craving, just the need for that fix in cigarettes, but that's a hard smell to get out. That's a very hard smell to get out. I can't see myself up in here just smoking and then just cigarette smoke just get everywhere and it get all in my couch and my clothes and my car. I grew up around that and I had no choice but to get used to it, but you know, it's just the smell of clean air and candles. Buy my candle. And you know, just good smelling scents and a clean house and Clorox and Lysol. What else? Men, let me tell you something. I don't understand y'all's point of view. I would like to understand. I'm not saying that I'm just ignorant to it, but please schedule your appointment to go to therapy. Normalize our men going to therapy. Okay? Therapy, therapy, therapy. Talk therapy. Talk to somebody to get unbiased ears and unbiased consultation to help you, not only to help you cope with whatever you're going through, but to help you, you know, get through it instead of just coping. Because just coping is like, I don't want to just cope. I want to get over whatever issue I'm going through. That way I can go on about my life and, you know, unblock those blocks that's keeping me from where I need to be in my life. Help me to let go of whatever that don't serve me, and, you know, help me out. Tell me what's wrong with me. I want to know. I want to be the first to know what is wrong with me in my head. Hey, doc, counselor, I think I'm finna go slap nuts. I would have them on speed dial. Please help me to know that I'm not crazy. I'm not crazy, right? Because I'm really finna throw this chair at somebody. I'm not that crazy, I promise. But I would like to know what is going on with me and help me to be sane, stay sane, so I don't do nothing that I will regret later. Also, I say this a lot, but this is very, very, like, I don't think a lot of people are taking this seriously, but colonoscopy, people, especially men, because men are more prone to colon cancer. Go get your colonoscopy. If possible, get your colonoscopy before 40 years of age. Why? Because people are being diagnosed with colon cancer at earlier ages and at later stages. Chadwick Boseman went for a checkup, he got his colon checked and found stage 3 colon cancer, which is too late for surgery. So, and he passed away 3 or 4 years after that. Get your colonoscopy before 40 years of age if possible. If it's not covered in your insurance, before 40 years of age, because insurance policies cover colonoscopies and mammograms at a certain age, like a whole bunch of different things at a certain age. Because if it's shown to like it's being ordered at younger ages more often, then they'll probably change that formulary to, you know, maybe 35 or something. But, you know, it's just that whole rule in insurance. It's causing a lot of late diagnoses of really serious conditions that can be life-threatening. So if it's not covered in your insurance, then go to your local Health and Human Services Commission, like I say every video, and get the help they have to offer you. Find resources, be proactive in making sure that you get as much preventative treatment that you can. Yearly exams are covered in your insurance 100%. As long as you are current, it's in good standing, and you paid your premium for the month, your visit for your yearly exam is going to be $0 out of pocket. That is law, part of the Affordable Care Act. So it's no excuses. If you have not had your yearly exam with your primary care provider and you are overdue for a yearly exam, schedule that appointment. Give them your insurance information. Go in there. You will get checked out. Most likely labs like blood draws will be covered in that too, because it's considered preventative. And also, if you vaccinate, certain vaccinations are covered in your insurance 100% with $0 out of pocket costs, as long as your premium is paid and it's current. It's so much. I'm thinking about going ahead and making a course to help people navigate, you know, basic insurance coverages. That way they know what their insurance does and does not cover. Because that's important, because people are paying for health insurance nowadays and they don't know what they're paying for. Like, they're just paying for it because that's just something that they know that they should have, and they have family, and in case something happens, then they just have it. But they are pissed to find out that their insurance will only pay for like just a routine visit, not a yearly exam, but a routine visit where you can only pay a $30 copay and you're good. But if you go back, you got to pay like a whole deductible for another appointment. You pay $30 for a copay one visit, and then if you go back the next month, they'll probably have you paying like $100 and something for a visit. Like, whoa. So I'm thinking about making a course for that. So keep a lookout for that. But yeah, know what insurance you have, and know what your insurance covers before you go to that doctor's office. Seriously, I do not want to sit in the doctor's office and be surprised that my heart study isn't covered because I have a deductible, $5,000 deductible. Then they give me a prescription to go somewhere, and then like the medication is like $200. No, man, no. And I'm paying how much in a premium every month? And it's not paying for nothing until I pay $5,000 before y'all start paying. Oh no, I'm doing a whole course. Y'all wait on it. Just wait on it, because it's ridiculous, and it's cheating folks out their money, and it's unfair, and it's greedy, and it's stupid. Says a healthcare professional, because it gives us hell too. Because there will be prior authorizations that's needed for certain medications and procedures and stuff, and we got to stop what we doing to get on the phone to make sure that they get this prior authorization approved. And then sometimes they won't approve it because I got to take this one medication first before they take this medication that the doctor knows is going to work for it. Again, just wait on it. Moving on. Keep your doctor's appointments. Make your doctor's appointments. Sir, you need your yearly exam. No, you're not sick right now, at least that I know of or that you know of, but go to make sure that you're not sick, because you can have something, or you can be dealing with something internally and you don't know it. Could be something as small yet serious as a parasite. Reason why you're eating so much sweets lately. I am your health coach. Dentist appointments too. I gotta make my appointment. I just got my card in the mail. Make your dentist appointments, get your cleanings, get your teeth cleaned, get your teeth checked, get those cavities filled before they get worse. And if you don't get your teeth looked at, if you don't get those issues fixed, then it turns into worse issues. You get your teeth falling out, and then, believe it or not, heart problems can be caused by poor oral hygiene, cavities, abscesses, things like that. Yeah. And definitely ask questions at this doctor's office visit. Ask him questions. And no question is stupid. There are no stupid questions when you ask a doctor about your health. If you asking about a bump that's been on your hand and it's been there for like 3 weeks and you're not sure why it's not going down, ask them. Ask them. Tell them what's been going on, what you've been feeling. Has it been swelling? Has it gone down at all? Has it gotten worse when you scratch it? Have you scratched it? Did anything bite you? Ask them. Write a list of stuff you want to ask during your yearly exam, because you'll have at least 30 minutes to an hour with them. You're paying for the doctor's time and advice. So definitely do that. It's your body. You're asking for his knowledge, his experience, and his healing. You trust in him with your life, so ask him questions. Okay. One big one. I know I talked about health insurance, but men, get life insurance policies. Life insurance. You know why? Are you set? Are you set? Do you have a good savings put away for when that time comes? Will your family be set? What financial burden will they be stuck with when that time comes? I mention that because men have a shorter life expectancy by 6 years compared to women. Women will live to be 80 plus years, and the man's life expectancy is 74 to 76 years old in the US. Is your family set? Think about it. Finally, I need a little spiritual here. Serious note, because men don't talk about their inner, that fuzziness in there. Fellas, your heart is 2 times bigger than ours, and we're the crybabies. So I can only imagine how much, man, it's like you could be calling out for somebody. You need help, but you were instilled at a young age, like, you got it. You got to be a man. You got to be a man and grow up. And yet men don't cry. Boys don't cry. So where do the tears go? Where does that energy go? It just sits in there. Like, who do they talk to? You gotta talk to somebody. You gotta let it out. You don't benefit at all from suppressing what's inside of you, that's trying hard, that's crying out to come out. If it needs attention, if you need attention, if you need emotional support, allow your tribe to hold space for you. Okay? It has to be somebody that you can trust. If you don't find somebody that you can trust, that is a part of your tribe to hold space for you, sit and just listen to you and let you talk and vent. You can vent, you can, and I say all the time, I speak once and I listen twice. Speak once and listen twice. The more that you listen, the more that you learn. The more that you learn, the easier that you can apply it, and it'll stick. Listen to what he has to say and give that emotional support to him. Make sure that he knows that you're listening to him. Use active listening, meaning listen to what he says and repeat back to him. Okay, so this is what I think you said. Insert statement here. Is this what you said? That way he knows that you understand what he's saying. Because if he's just talking and, you know, just going in one ear and out the other with you, then, you know, he thinks that you're listening, but you're really not, because you're just sitting there and you're just quiet. But really listening to him and hold that space for him to, you know, just let it out, because men got words too. Men got feelings. Men want to be loved. Men want to be hugged. We're normally given those, you know, those neck church hugs and those protective hugs where they're wrapping their arms around our body and stuff. But men want to feel that protection too, and that safety and security, which, you know, they were taught at a young age that they're the protectors, they're the hunters, they're the, you know, they're that foundation, that stability, when, you know, sometimes foundations need maintenance. Fill those little holes and stuff with, you know, just filling those holes. Upkeep. Even your car needs upkeep, or else it's going to stop running. So, emotional support. And fellas, allow yourself to be celebrated. Because it's a lot of men that'll say like, oh, you know, it's nothing. It's, you know, like for real though, it's Father's Day coming up. Show gratitude for, you know, the people that are in your corner, that's coming to see you and celebrate you on Father's Day, because it's men that's working 12, 16-hour days and just going home, and they come from one place where they're not, you know, they're probably looked at as a number, and then they go home and then they're not getting any attention, any love or anything at home from their girlfriend or wife, anything like that. That's like, well, dang, where do I, you know, when people think of home, especially a man, when a man goes home, home equals peace. Peace. Quiet. Quiet. They don't want drama at home. Especially not at home. What? I don't know. He gonna be in survival mode and get to, he gonna say something first. Definitely he gonna say something. And when he feel like that message isn't going through, It can be something thrown. It could be something figuratively thrown, or like maybe physically thrown. Like, hey, you're gonna feel me today, and you need to such and such. Get it together. I need silence in my house, in his house. He deserves it. He works 12, 16-hour days, and he needs peace and quiet in his house. And when he has his partner there, his wife, his girlfriend, whoever, that person is seen as somebody that he can get peace from and keep drama away, and like, you know, a sense of renewal, refreshing, rejuvenation. You don't want to go home and argue. You don't want to go home and see just a whole bunch of just stuff everywhere, and then like just, you know, you and your homegirls there. When he get home, he wanted peaceful peace. And as women, we have to hold space for that. We have to, yeah. But yes, allow yourselves to be celebrated for sure. Don't say, oh, it's nothing, you know, you know, no, just, you know, embrace it, and allow us to wash your car every now and then. I don't know, just, you know, just allowing and giving gratitude, and just receive your flowers. Okay? Receive your flowers. And we have to hold the responsibility of giving our men their flowers while they're still here. But back to my ladies. Ladies. You are loved, respected, and respectable, and worthy. Show gratitude to our men. Show love. Allow our men to express their thoughts and their feelings, emotions, and create a safe environment without judgment or the need to respond. Just let them talk. Let them get it out. Don't argue, because whatever comes out of his mouth, it's his reality. Just listen. Let him finish. Find a solution. And then give your side. Effective communication. There's no communication. What the F? How you can't communicate with the person that you live with, that you share your life with? Who does that? If I can't talk to you, why are you in my space? If you can't talk to me, why am I in your space? So us ladies have to speak once, listen twice. And that will cause a whole lot less drama. To our men, you are loved, you are nurtured, you are respected and respectable, and you are worthy. Allow us to hold space for you, to open up to us and communicate and feel what you're feeling. And there's no need to worry that your vulnerability is not safe or valued. Feel that freedom to communicate and feel, you know. I want to give advice to the fellas. Please listen to me. This is important, because we're at a constant battle as Black men and Black women when it comes to love and relationships. And, you know, I can't change anybody's mind about what black men are attracted to or anything. This is one of the reasons why I wanted to do Men's Health Awareness Month, because, you know, women suffer, but men suffer worse from stress. And when men are stressed out, they come to us. They want that feminine energy to nurture them, age appropriate nurture, you know, and to build them up, and, you know, show them how to do certain things that they haven't been shown as kids, like how to sit in their emotions and things like that. And they require so much from us to help them feel secure and to trust and to talk, communicate, things like that. Now, men get their nourishment from women. With that being said, men, be sure, y'all listening, be sure that you water the tree that you receive shade and bear fruit from. Word of mouth. Men require so much from women. They require so much. And knowing how a woman, especially a very sensitive, empathic woman, especially like myself, I will try to pour water out of an empty cup because I care about this person so much. And, you know, just to show my value in the relationship, that I'll do anything just for him to, you know, approve. But, you know, it's, you know, we can do all that we can, and we're not superwoman. We're super and we're women, but we're not superwomen. But it's just, you know, we do everything, and we do everything we can to make sure that you're empowered, and just give them that same thing back. Give them flowers. Take them on dates. Man, tell her she's pretty. Just tell her she's pretty. Oh, little things. Just some type of reciprocation back to her. When you take from something, you give back to it, to replenish it, to nourish it, because men take and take and take and take and take and take and take, and a lot of times forget to fill that hole back up with something else. So the woman would feel drained and deprived, and, you know, you can take so much from a woman, but it's going to be a point where the woman isn't going to have anything left. And they'll still take, and it's like, I don't have anything else. Like, what else do you want from me? Like, what is it about me that, and it goes to the woman thinking, what is it about me that, to where you require so much from me, and then the things that I'm doing for you, I feel like I'm inadequate. I don't have enough value. I can't give you enough because I don't have anything else, and you aren't happy. So, and then the woman would not feel safe emotionally in that relationship. So, what that song say, when a woman's fed up, water the tree that you receive shade and bear fruit from. If that plant is not replaced of its energy, it will feel deprived, drained, unheard, and it'll lose its leaves and perish. The perfect synergy can create a lot less chaos.